Welcome to Medically Speaking. Our guest today is John Hart, Vice President for Long-Term Care at Kaleida Health. John, thanks for joining us today.
Thanks, Mike. I'm excited to be here.
So if you can, let's start out, talk a little bit about yourself. I know you're a veteran and a leader in long-term care, but tell us a little bit about yourself and how you ended up at Kaleida Health.
Sure. So I'm a lifelong Western New Yorker. I grew up in a family of 10 kids, and my mother was an RN. And from an early age, I always had an interest in caring for other people. Wasn't exactly sure where or how. My older brother, kind of one of my early mentors, became a nursing home administrator. And I just saw his career path and thought that was the best path for me to kind of follow along in my mom and my sisters. I have two sisters that are RNs in their path and helping people. And I can honestly tell you that it's my passion, and I couldn't imagine doing anything else with my life. And I appreciate the opportunities that Kaleida gives me, not only affecting, the residents at HighPointe, but also DeGraff and serving our community.
That's great to hear. And we'd love to hear the passion. You joined Kaleida Health at a very, very difficult time in healthcare with COVID-19 going on. The pandemic is really, back into a peak, the vaccine mandate. There's an awful lot of turmoil in healthcare right now. With your role overseeing both the DeGraff skilled nursing facility and then HighPointe in Michigan, can you tell us a little bit about each facility, what makes it unique, the types of population that you guys take care of?
Each facility has their own unique personality, but both are really focused on providing that excellent customer care. DeGraff is your neighborhood skilled nursing facility. The staff there have been there, choose to be there, and have been there for many, many, many years, and are very comfortable in caring for those residents and customers in Niagara County who need their services. HighPointe was the coming together or the joining of Military Memorial Gates Circle Skilled Nursing Facility and Deaconess Hospital Skilled Nursing Facility in this beautiful brand new building on Michigan. And their dedicated team really goes into these medically complex challenges with our 20-bed pediatric unit. We've got a 10-bed ventilator unit. In long-term care, you're not only caring for the person who were privileged to live here, but we're also caring for their families. And COVID has been a challenge for both facilities in that regard, with making sure that we maintain those family connections. The family is love. And in many times, our staff, our caregivers that are at the bedside become their family, especially during these crazy, challenging times.
So COVID's pushing 20 or so months here in Western New York. When you talk about residents and their family members, there have been challenges that you guys have faced trying to keep that connectivity going. Can you talk about the measures that you put in place to help families and residents visit, whether it was virtually or in person, the stops and starts over the past 18, 20 months? What are you guys seeing when it comes to visitation?
And I think that was a perfect way to put it, is we've seen, as we've gone through the pandemic, we've learned unique ways to connect families. And this is at the dedicated teams at DeGraff and HighPointe. We're doing virtual meetings, and they're nice. I mean, especially during the early days of the pandemic, it was a great way for the families to at least put their eyes on their loved ones, and there's no greater fear than not knowing what's going on. So that was very helpful in the early days of the pandemic. And currently it's more trying to get those live one-to-one or live interactions. Our big focus is really keeping the families and the residents safe. I feel for them. I feel for the team who every day comes into work knowing that they've got their challenges. It's long-term care today isn't the long-term care prior to March of 2020. Long-term care, we're facing a national staffing challenge, and you look at our tremendous caregivers and their dedication, knowing that they're going to come in, and there may not be ideal staff, but they come anyways. They're tired, physically, emotionally, and especially during the early days of COVID, our healthcare heroes, and that's not an exaggeration, face their fears every day, knowing that they could either become COVID positive or take it home to their loved ones. So I'm just proud to be a part of, to be a part of them, and to be a coworker of people that are just so selfless and caring and experts in their field.
John, you mentioned the challenges that you guys have faced the past, 16, 18, 20 months. We're in the fourth quarter of 2021. As we head towards 2022, what are some of the challenges that you guys are facing? And then how do you convert those into opportunities, whether it's staffing or a career opportunity for those who are working with inside, whether it's HighPointe or DeGraff? How do you take those challenges and convert those into opportunities?
Great question. And it's almost like the last 20 months have been just one wave after another, one challenge after another. Our biggest challenge right now is making sure that we have the qualified staff to make sure that those who are under our care are getting the attention they deserve. I can tell you, I've worked at many places in Western New York, but I have found that Kaleida Health, and specifically Kaleida Health Long-Term Care, is probably the most dedicated to making sure that their employees are well taken care of, and that their employees are getting the thank yous and the respect that they deserve, knowing that they face tremendous challenges with not only COVID, but the national staffing shortage. That's our big focus. Where it's going to be making sure that we have the right level of occupancy so that we're meeting the community needs, but it also is at a level that our current staff can safely care for their needs. And the amazing leadership team at HighPointe and DeGraff are getting together and putting their heads together to look at, okay, what are the needs of the community? What are the new skill sets that we have to learn, or the equipment that we have to purchase so that we can still do that?
Sure. And you mentioned answering the call. As we wrap up here, if you can, last question or more of a comment here is, this is your opportunity to have a special message for your staff that you have been working side by side with since you joined the organization back in the summer. Any special message for the workforce or for your staff?
Yes. First and foremost, I want to thank them for choosing Kaleida Health as their employer. They have options. They can go anywhere they want in Western New York, and the fact that they choose to come to work for us every day, I just can't begin to thank them enough. And the fact that they have that caring heart, that great, they come to work with that greater noble purpose, that they are going to care for somebody and change somebody's life today, is just, it inspires me to be better. And, I wish there was more I could do to let them know that they were appreciated, and that what they do every day is amazing, and the amazing people that they are.
John Hart is the Vice President for Long-Term Care for Kaleida Health, here today talking about his staff and the great work they have done all through COVID-19. John, thanks for joining us today.
Thanks for the opportunity, Mike. Have a good day.